Good evening and thanks for joining us. I'm Rob Macko. A new high-risk overdose prediction alert sent through social media has many people asking how it works. Well, 13 News reporter Lane Ball spoke with local and state leaders about it. He shows us how they make these predictions and how people can prepare.
Health officials in West Virginia say they are using predictive modeling to prepare for overdose number spikes, which means when they see a spike in overdose numbers in nearby states, they send out the alert, the first being through social media and lasting 36 hours. Now, there were 23 counties on the high-risk list, including Boone, Cabell, Clay, Logan, Kanawha, and Mingo counties. And during that time frame, health officials, law enforcement, and volunteers are also checking in on the individuals going through addiction recovery. I went on a ride-along with the Huntington Quick Response Team and saw firsthand the work they're doing to ensure an overdose doesn't occur. And if it does, that those nearby have the tools to revive them.
Typically, we'll make like a route of where we go.
Huntington QRT leader Larissa Cox says on a regular basis, they do check-ins with some of the people who have or are currently in addiction recovery, offering resources like naloxone.
This gentleman we have dealt with before, and he was in recovery, and then now I guess he has had a slip up, so we'll go visit him.
Cox goes on to say that these are courtesy visits to make contact with the people and let them know that help is available if they need it.
4th Avenue apartment for a possible overdose.
And in some cases, they respond to overdose calls over the scanner, also offering their assistance when needed and giving out free naloxone kits. DHHR representatives say this latest alert service is designed to give family members time to prepare if they need to use the tools that the quick response teams provide.
We're working hard to make sure if we know those overdoses are coming, to make sure that we push out more naloxone out there.
Reporting in Huntington, Lane Ball, 13 News.
And for access to treatment and recovery resources, the state is asking people to call 1-844-HELP-4WV.